Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is the healthy ketogenic diet, and in particular, the healthy ketogenic diet. Is it possible for elderly people? And I don't want to offend anybody in terms of elderly, but the two people that I'll be talking about today are 76 and 81 years old, and I'd like to just share their stories to perhaps give you inspiration, no matter what your age, that the ketogenic diet can be a very powerful disease-reversing, health-promoting strategy. And both of these individuals had very different reasons for deciding to follow the ketogenic diet. But one of the points I want to make is that most people think that somebody that's 80 years old is not going to make a change in their life and sustain it. And most people think that somebody that's 75 isn't going to is the same way. And my experience has been that when people are properly motivated and they have enough information, that they make good decisions for themselves. The problem is that most people don't have enough information to make a good decision, and so they make lousy decisions that don't help their health in the long run. So both of these ladies had very different stories. The first person, 76-year-old, was a new patient to my practice over a year ago. And she's diabetic. She came in because she was a new diabetic patient. It was a shock to her. And she had been told by the first practitioners that she saw that she was going to need to be on a bunch of different medication. And she didn't want to be on a bunch of different medications. She wanted to understand what her options were. So I have a simpler program that I call the modified plate, which is part of my low glycemic eating plan, which normally will reverse diabetes by itself, but she wanted to know what she could do to do it as fast as possible. And so I explained the ketogenic diet to her, which I've been teaching patients for several years. And so she decided she was going to do that. And within 6 months, she had completely normalized her blood sugars. She lost a lot of weight. Her blood pressure was down to normal. Essentially, she was off of all of her medication. Now, this was the usual diabetic patient is on a couple of medicines for their diabetes. They're on something, they're supposed to be on a statin drug for their cholesterol. Most of them have 1 or 2 blood pressure medicines. So most of these folks are on 5 medicines or more. And this lady had successfully completely eliminated all of her medicines within 6 months. And a year later now, one of the points I'm trying to make is that a year later, she's still successfully doing it. And what she's successfully doing is still losing weight, but she's also successfully following the program. In other words, this is not a flash in the pan kind of program. Once people learn how to do this properly, they feel better and better and better, and it's easier and easier and easier to do it. Now, why do I call this the healthy ketogenic program? Well, the reason is that most of the programs out there that purport to be ketogenic aren't healthy for the long run. Now, if you just have a short-term goal and you just want to lose some weight and you want to be keto for a while, these things don't make as big a deal. But the longer you plan to be keto, the more important it is that these details of what constitutes a healthy ketogenic program that they're paid attention to. Now, these are also details that people that aren't on the keto diet are also missing. So I'm not trying to just blame it on keto folks, but the point is, if you're going to do the ketogenic diet, you're definitely going to be limiting some critical micronutrients that most people easily get because they're eating fruits and vegetables. So what do you do instead? And so that's part of the solution for a healthy program, is making sure that the critical micronutrients are being attended to. Now, one of the paradoxes of the ketogenic diet is that most people on it are getting insufficient amount of the 2 fats that we call the essential fatty acids, or they're getting them in the wrong ratio. If you have them in the wrong ratio, or you don't have enough of them, then you're going to pay a price for that. You're going to pay a metabolic price for that. Your brain is going to pay a metabolic price for that down the road. Now, one of these two are called the essential fat. That's an omega-3. It's abbreviated ALA, and fish oil is not a substitute for it. So getting enough ALA is really critical to be on a healthy ketogenic diet, and most people are getting way too little ALA. The second one is the omega-6 essential fatty acid, and it is abbreviated LA, and many people are getting too much omega-6, but most of the omega-6 that they're getting is damaged omega-6, so getting undamaged omega-6 in sufficient amounts and in right balance with the omega-3 is a really critical part. It's foundational for doing keto right for the long run, for the long term, and most people are not aware that they're even supposed to pay attention to these things, so they don't. Other factors that are really critical include multiple micronutrients that most people are not getting because the foods that they have just don't have, the foods that they're eating just don't have enough of these micronutrients. So it's important to know which ones are in the foods you're eating for the long run, or alternatively, how to supplement in a way that covers the bases effectively. Now, there are three things that I want to kind of focus on here that these two ladies accomplished. Number one of them completely reversed her diabetes. And the second patient she was pretty close to the point where she was not able to take care of herself anymore because her memory loss was so bad. But she had just enough left to be able to put together a decision to follow the program. And so her memory is, her memory is back to where she was maybe 20 years ago. And because I've seen this patient for quite a long time, and she was sharp as a tack 20 years ago, but she had reached a point where I was fearing for her safety living alone. And now she has basically recovered all that. And that's because she's on the ketogenic diet. Now, why does that help? Because the brain cells like ketones for fuel. And as people get older, their brain cells use glucose for fuel poorly. Some people do. And there's a lot of reasons why that happens. It doesn't happen inevitably. But because of the typical American diet, we kind of destroy the brain's ability to use glucose for fuel efficiently. But we don't lose the ability to use ketones for fuel. And so the ketogenic diet is great for brain health. No matter what the brain problem is, the ketogenic diet is good for it, because ketones for brain fuel is a very powerful way for your brain to be able to recover stability. And that's what this lady has done. In addition, she has lost a massive amount of weight. And that's what both of these ladies have done and are still doing. Now, one of the consultants that's seen the second patient is afraid that she's losing too much weight because she has lost so much. But this lady's not losing muscle. She's just losing fat because she's doing the ketogenic diet. And when you do the ketogenic diet correctly, you save your lean body mass. You just lose the fat that you don't need. And that's exactly what's happening with this lady. She looks more robust than she has in probably 30 years. But the point is that both of these ladies are having profound weight loss, and it's healthy because they've got the micronutrients covered. And so I want to encourage you that the ketogenic diet is great for lots of different reasons. Over the short run, these micronutrient issues are less of an issue, but the issue accumulates in insignificance the longer you're in the ketogenic diet. And of course, it never hurts to be having all of these critical nutrients there from the very beginning. So I do want you to be aware that all ketogenic diets aren't created equally. Now, what we did is not try to reinvent the wheel. There's a lot of different ways out there to show you how to do ketogenic diet, but there's nothing out there that I know of that is like what we've created as a tool, which is to show you the critical things that you uniquely have to pay attention to if you want to be doing the ketogenic diet healthy in a way that's not missing critical micronutrients, especially the essential fats in the right amount, especially if you're older or if you have a chronic disease. So if you have interest in doing the keto diet healthy, in a healthy way, I encourage you to check the program out more. And If you're just interested in the basic concepts are you need to get the essential fats right, and most people don't. They don't get nearly enough of the ALA, and they have the wrong ratio of ALA to the omega-6, and they've got damaged omega-6 to boot. So there's a lot of other questions related to ketogenic diet that I don't want to get into on this program. I just want to encourage anybody that if you think you can't do it, think of an 81-year-old lady that can barely walk and has lost her memory so much that she can barely take care of herself, but had enough to put the dots, connect the dots, and said, I got to do something. And so she follows this program. More than a year later, she has had all of these positive effects, and you can too. I want to encourage you. You can too. And it's not complicated. It's not complicated. So I wish you well, God's blessings, and have a great day.